Welcome to Retirement Rescue Radio, a show specifically designed to help retirees and pre-retirees maximize their financial efficiency so you can live the retirement lifestyle you've always imagined. Your host is Nate Miller, investment advisor representative and author of the CPR Retirement Rescue Roadmap. Nate discusses thoughts and ideas from some of today's most knowledgeable professionals in the field of finance. He offers strategies along the way to help you make better financial decisions so you can maximize your retirement. This is Retirement Rescue Radio.
Well, hey there, Retirement Rescue Radio listeners. We're back for another episode, and I'm your host, Nate Miller. And today, we're going to talk about Social Security. And so, yes, we have had the estimates of what the cost of living adjustment is going to be for next year. And according to, I believe it is SeniorCitizenLeague.com, it is set up at, let's see, what is it? Senior Citizens League. Yep, 6.2%. And that's up from 6.1% last year. So 6.2, that is the largest increase in a very, very long time, guys. So that is great. There's also talk that Medicare is going up too, but it's only going to be going up about $10 a month in the premium. So much bigger cost of living adjustment this year than what we've had in the past. And it's not going to be eclipsed by the Medicare premium. So that is awesome. But that's actually not what we're going to be talking about today. Today's topic is Social Security, yes, but it's more of how COVID has the recession that created has actually pushed the Social Security Trust Fund insolvency back by a whole year. Or I guess it's brought it up by a whole year. It hasn't pushed it back. It's brought it up a whole year earlier. So it was at about 2035. And now it's going to be 2034. And so it's basically, it says for the first time in 39 years, the cost of delivering the benefits is going to outweigh the program's total income from payroll tax collections and interest during that year. And from there on, Social Security will just be, I guess, tapping into whatever people bring in. So the trust fund is going to be depleted at that point. And the depletion date for the Medicare trust fund, though, still remains unchanged from last year. And guys, if we haven't really talked a lot about that one, that date is 2026. That's just around the corner. And so there's going to be needing to be a lot of different things. And so we're going to go through an article here that is through AP News, and it's by Ricardo Alonso Zaldivar and Martin Krustinger. And this literally today is the 1st of September, and this came out yesterday. So the sharp shock, I guess, of coronavirus recession is really what pushed the Social Security to that year closer of insolvency. And now I have to preface this and remind you that it does not mean that no more Social Security checks are going to be coming if this happens. I mean, think about this. Back in the 1980s, this actually happened. You know, financial warnings about Social Security prompted then President Ronald Reagan and lawmakers of both parties in Congress to collaborate and on a long-term solvency plan. But there's questions on whether or not that can actually happen today because we've got a much more bitter political climate than what we had back then. Democrats who control the White House and Congress have offered assurances, though, that they would try to protect both programs. And the Biden-Harris administration is committed to safeguarding those programs and ensuring that they continue to deliver the economic security and the health care to older Americans. And that actually came from Janet Yellen, Treasury Secretary. So we do know that he does, or when I say he, Biden does have an idea of what to do for Social Security. We haven't really heard much about how to shore up the reserves for Medicare. These two programs, Social Security and Medicare, account for 40% of our national budget. 40, exactly. And so that's huge. And so, and remember, so we are not going to have Social Security go away in 2034 now, as what it says. This article does go on to say that we still have enough people paying into the system that we could pay about 78% of the necessary benefits. And so right now, it looks like worst case scenario would mean that everybody would have to take a pay cut if nothing is done from between now and then. right? So there's a lot of factors that have gone into this, and reasons why the Social Security date has been brought up a year and the Medicare date wasn't covered is because the latest estimates, they actually reflect a push and pull of a lot of different factors from the pandemic. And really the full impact might not be figured out until, years to come. But the death toll from COVID-19 concentrated among older people, it did reduce future Social Security payouts. And hospitals were stressed by the influx of COVID patients, but Medicare didn't have to pay for as many knee surgeries or as many colonoscomies or any other routine procedures because of COVID. And then so that actually helped the Medicare situation and didn't really help, or sorry, it didn't really affect the movement of the year of insolvency for Medicare. However, birth rates and immigration, which tend to bolster both programs, actually fell last year. And so that's one of the reasons that Social Security was impacted a little bit bigger. The loss of the payroll tax revenue outweighed any savings from what the program would have paid out to people whose lives were lost in the pandemic. The report noted that the employment, earnings, interest rates, and economic growth plummeted in the second quarter of 2020 after the pandemic hit the United States, and that's not any that's not any new news. Even though the finances of both programs have been significantly affected by the pandemic, the Medicare was affected less. So there's no consensus really on what the long lasting effects of the pandemic are going to be. A looming question for Medicare is going to be, will the population of beneficiaries who survived the pandemic, will they be healthier on the whole? Or will a high number of them suffer from what we call long COVID, right? And so is there going to be additional effects from that? Social Security right now pays benefits to more than 65 million Americans. And mainly that's retirees, but there's also disabled people and survivors of deceased workers that are in there too. But the vast majority of them are going to be the retired workers. And Medicare covers more than 60 million older and disabled people. And together, both programs, like I mentioned, 40% of the budget. And so that's not just a stabilizer for people. That's a stabilizer for entire families. And if you think of it on a much larger scale, the entire national economy. So government economic experts who prepared the Social Security report, they're estimating that because of all of the high inflation that we've got, like I mentioned a little bit earlier, about 6.2% is going to be the COLA for the cost of living adjustment for next year. And that's a huge jump from the 1.3% that was put in place last year. So that's great news for those that are on Social Security right now. Now, there's only, like I said, there's only part of that that's going to higher Medicare, because the premium right now is set to go up to about $158.50, which is about a $10 increase from last year's premium. So not huge. You should be getting a larger increase in your Social Security dollar amount than you're having to pay in your Medicare premium. So that's great. Now, I mentioned that Social Security had about 78% ability to pay scheduled benefits once that trust fund is completely depleted. Medicare's trust fund, when that runs short, it's going to be able to pay 91% of expected cost, and that's mainly hospital bills. So it's a little higher. It's got enough coming in that it's going to be better off. But there are a few things that could be put in place in order to shore those up. Like I mentioned, one of Biden's ideas that he has to help shore up those reserves and maybe kick that year, farther down the road, because this did happen back in the 80s. That was, like I mentioned, one of the reasons that Ronald Reagan put in some of the changes to Social Security that he did in the 80s. And so this is not the first time that we have run up against the issue of Social Security not running out of its trust funds. And so that was really back in the 80s. That was when Social Security was able to be taxed. And before that it wasn't. And so that helped basically kick the can about 39 years down the road. And so now we're sitting here looking at it again, needing to do some other things. And what Biden is suggesting is right now there's a cap on how much we pay Social Security or how much tax we pay into Social Security based on our wages. And I think I've mentioned this in a few other episodes as well. And that number is 140,000-ish or something like that right now. If you hang on really quick, I'll be able to tell you what that is. for 2021, $142,800. So once anyone makes over $142,800, nothing else that they make, do they have to pay Social Security tax on it? None, right? So if you make $200,000 from 142 to 200, you didn't pay any Social Security tax on that. If you make 300, 400, 500, whatever, 142.8, that's all you're going to pay Social Security tax on, right? And so Biden's plan is, or what he's proposing is keeping it at 142,800 and just continue to adjust it for inflation like we have. He's not going to kick the cap up just right there, but he's going to create basically a donut hole that goes from 142,000 to 400. So you still wouldn't pay any extra Social Security tax on any wages from 142.8 to 400, but after 400, you're going to pay Social Security tax on that. And guys, this is one of those cases where something has to be done in order to shore it up. And it's not going to please everyone. It's like, you can try to please everyone, but it's not going to happen, right? I can't remember what that saying is. It's like, you can't please all people all the time. You can please some of the people all the time, or all the people some of the time, but never all the people all the time. So some semblance of that. And this is not going to please everybody, right? And so I feel like this is a good compromise, though, because like I said, if they just kicked the cap from 142.8, they just kicked that up to whatever they wanted to kick it up to, 200,000, 250, whatever it is, that's going to affect far more people than if they kicked it up to 400. And I'm not one that, says, let's just tax the rich, because that's not the answer. A great idea would be, hey, how about we spend a little less? How about we cut some of these programs that we really don't need, right? It's like when we're trying to balance our budget at home, we don't just try to increase our income all the time. We try to cut out some expenses too. Novel idea, government. Let's try that. So there's that portion of it. 142.8. So that's going to be the maximum that's going to be taxed, and he wants to create that donut hole, go up to 400,000. I don't know the numbers behind that. That's one thing I have not seen in all of these articles, is how well would that actually work? What would be how many years could that kick it down the road, right? Are we looking at 39, or are we looking at 10? What are we looking at? Are we going to have to do something else just very, very soon in order to shore up the reserves again? Or is it going to be a good long-term solution? I haven't seen any of the numbers on that. I haven't found any of the numbers on that. If any of you do, send them my way. Ask Nate at retirementrescueradio.com if you find any articles out there that actually have those numbers. That would be great. It is unclear, going back to Medicare, how the Medicare projections are going to affect the debate on Capitol Hill about authorizing a program to negotiate prescription drugs and then using the projected savings to provide new Medicare coverage for maybe dental or vision or maybe even hearing services. Of course, there's arguments on the Republican side as well that any savings should go to shoring up the program, not to expanding benefits. Once again, let's cut spending instead of increasing spending, but that just means fewer benefits as well. So it's give and take. It's like shoring up the program, or making beneficiaries of the Medicare program have to bear more of the brunt of the services. So that's it. Also, Medicare has the report steered clear of making any projections about the new Alzheimer's drug, Aduhelm. It's ADUHELM. Sorry, ADUHELM. I'm not sure exactly how that's pronounced. I'm going to pronounce it Aduhelm. That has a list price of $55,000. And most of the 6 million Americans dealing with Alzheimer's are covered by the program, though not all of them will be candidates for the medication. So there's a lot of issues going on right now. And the U.S. economy, what really accounted for a lot of this was they lost over 22 million jobs in March and April of 2020 alone during the pandemic. And we haven't gotten all those back yet. We've only got about 16.7 million since April of 2020. So that still leaves a gap of about 5.7 million jobs to get back to the pre-pandemic levels. So we have less money going into Social Security, less money going into Medicare, but as it pointed out, that wasn't really as big of a hit to Medicare. It's a much bigger hit to Social Security. And there's a few things that they're talking about. It's like, are they just going to try to implement some of those ideas that Biden has if those end up getting passed, or are they just going to go further in debt? We have had past Federal Reserve chairmen say if Medicare or Social Security does go bankrupt, they'll just print more money. And that's a little scary coming from someone in that position. So I guess ultimately here we've got good news, bad news, I guess, because we've got a big cost of living adjustment going on for 2022. So that's the good news. The bad news is that coupled with the loss of the jobs last year has accelerated when Social Security may possibly lose all of its trust fund proceeds. So that's the issue there. Once again, I think there could be a few things that could happen to shore those up. I just don't know how viable or how long those solutions are going to last, because like I said, Ronald Reagan's lasted for quite a while, but I don't know how long this one is going to last. I've seen no projections on that yet. So stay tuned on that. As soon as we find that information, we will definitely get that out there to you. And if you have any questions about how this might affect your specific situation, if you do take a pay cut, you were getting say $1,000 a month, now you're only going to get $780 a month. How is that going to affect your retirement lifestyle? Is that going to affect your portfolio? Well, it absolutely would if you had to make up that difference. But does that mean that your portfolio is going to run out if you're only going to be able to earn 78% of your Social Security benefits? If that's something that you're not sure about, get a hold of us. Ask Nate at retirementrescueradio.com, or we'll have a link to our calendar in the show notes. You can just hop on for a quick 15-minute phone call, get some of those answers or questions answered pretty quickly, and then find out whether or not we need to take a deeper dive into your retirement situation to see if there's anything else that we can do to put you in a better spot for the rest of your retirement. So that's it again, guys. Thanks for tuning in. And there's my good news, bad news for Social Security going forward. Take care, and we'll see you again next week.